Hello everyone, Dr. Sutter Caton, physical therapist here with Vive Health. I'm looking forward to sharing all my knowledge with you and I hope you enjoy. The exercise I'm going to show you next is improve the strength of the dorsiflexors of the ankle. So it's important to strengthen these muscles to aid in improving the range of motion of dorsiflexion, which can alleviate pain from an ankle sprain and also reduce the likelihood of developing a sprained ankle. So I'm gonna have my band anchored away from me. I'm gonna wrap this. I want it around the band. I would like around kind of the base of the toe, so I don't want it super far down on the foot because it won't give you much resistance. I don't want it too far on the toes or the band may slide off. I'm gonna come out till I have some decent resistance on it. I'm gonna let the band pull my toes, and then I'm gonna pull the band, pull my toes towards me. So what's going on here is you should feel the muscles kind of on the outer front of the calf working, the shin. I want to make sure my knee stays down, so a lot of people have a tendency to cheat and do that, and you're defeating the purpose. You're kind of using some of your stronger muscles. I really just want that ankle moving. Should feel that muscle right there tightening up. When we're performing this exercise, we're gonna go a little bit higher repetition to start, so we may work all the way up to 20 or so repetitions. As you increase the resistance with a tougher band, still wanna work a little on the higher rep range because the muscles involved are more endurance muscles, meaning they don't need to produce a ton of force, they just need to have endurance to work throughout the day as you're walking, as you're running, any of the activities you do. So I'm looking for 2 sets of 15 to 20 repetitions. And this is one early on in rehab and the weight is light. I might perform every day. Down the line, I'm looking at performing this every other day. This next exercise is called ankle eversion with a band. So eversion is where your toes sort of point outwards. And so when you roll your ankle, these ligaments, these muscles along the outside edge of the foot can be damaged. And when that happens, we want to make sure that we're strengthening those muscles and allowing everything to heal in the proper position and also prevent future occurrences of rolling the ankle. So this exercise is designed to target the muscles responsible for keeping that ankle where it needs to be. So I'm gonna I'm gonna be sitting rather. I'm gonna have my band, and so it's important step here is it's gonna go around the foot, and then it's not just coming straight back. I'm going to anchor it around my other foot. So that allows where the resistance is actually pulling from to be from the side versus straight on. So I've got it anchored around my other foot. And then what I'm gonna do is I'm gonna let the band pull me in, so you can see I'm basically pulling into that rolled ankle position. And then I'm gonna bring it the opposite way. So I'm letting the band pull, and then I'm thinking about rotating the foot out, almost like I'm bringing my little toe towards me. This is another one early on. I want to keep the resistance light and I want to do higher repetitions. So I would go even up to 20 repetitions of this one, at least once a day to start out. But like I said, keep it nice and light because we want to make sure that we're maintaining some strength in those muscles. Also with a rolled ankle, those muscles may, what we call sort of shut down is a way we like to describe it. Just because there's so much pain in the area, those muscles sort of stop working. They think they're helping, but we got to kick those muscles back in, teach them how to do their job. So 20 repetitions. And then once you can handle that without too much issue, I would either get a tougher band, or you can always just pull a little bit harder on the band to give yourself a little bit more resistance. And once it gets a bit tougher and you're using more resistance, I would lower the reps to maybe 15, and I would perform this every other day for a couple of sets. So once we've strengthened some of those muscles with banded exercises, this is the next exercise to sort of progress yourself to, because now that ankle is moving, we're also bearing weight and we're starting to put the pieces together as far as the strength and range of motion component to improve the amount of dorsiflexion we have in the ankle, and that's going to allow us to have a better chance of preventing ankle sprains because the ankle can move a little bit better in the way it's designed to. So what I want to do, I want to have some object in front of me. It can be a wall, it can be a chair, just something to hold on with my hands. I'm going to go into a half kneeling position, we call it. So the side I want to work on is in front. And then what I'm going to do is lean my body weight, shift my weight forward to bend or dorsiflex this ankle. So a couple things you want to keep in mind. I want to only go as far as I can without the heel coming up. So if I go here and then the heel starts rising, you're defeating the purpose. No point in doing it past that. I want to go just to where the heel stays down. I want to think about not just passively going into the motion, but I want to think about using those muscles to pull myself into the position, pull myself into the stretch. It may feel a little stretch on the back of the calf, but it's okay if you don't. So I want to also be in line with my foot. I don't want the knee to come in too much. I don't want the knee to bow out too much. We're only going in a pain-free range of motion. So if I go any further, I start to have pain, then I'm gonna back off a little bit and not go quite so far. This is one, once again, it's kind of one of those where we're not working the muscle so hard. It's more to just get that, some movement, some healthy movement in that joint. So it's one that I would do for minimum of 10 repetitions a few times a day, but really it's one that I would do even a little bit more until you feel like you notice a change and you can go a little bit further compared to when you started. This next exercise is a great way to strengthen the ankle and the Achilles tendon after Achilles tendonitis issues or an ankle sprain. So what you're gonna need is some sort of step. So whether it's a step to get into your home or just some sort of object a few inches in height and something to hold on to. So the easiest way to perform this exercise is with both legs. So I'm gonna have both feet on the step. I'm gonna have the heel hanging off the side. I'm gonna lower myself down, feel that stretch in the back of the calves, and then push up. Now, for most people, especially as you get stronger, this is a fairly easy exercise and a good method to make it more challenging, and really an effective way of working with tendonitis is to do an eccentric. So what I'm gonna do is position the foot I wanna work, the leg I wanna work a little more in the center of my step. I'm gonna lift the other. I'm gonna lower down with just one foot, and then I'm gonna use both to come up. So I'm overloading that muscle and tendon by making it work by itself on the way down, but then using both to come back up. So make sure you're controlling the way down. You're not just coming down quickly. We want to really control, feel that stretch, and then both to come up. Like that exercise to be performed anywhere from 10 to 20 times, picking a modification that challenges you enough. And you're gonna repeat that for 2 sets, twice a day. So next we're gonna work on balance, which is really important to get back after you suffer an ankle injury, as those muscles and just your proprioception, your awareness of that ankle tends to be reduced after an injury. So we gotta build that back up, build the strength, build the confidence in that ankle. So the best way I like to do is just simple single leg balance. So you're gonna go on the foot of choice. I want a little bit of bend in this knee, so I don't want to completely straighten and lock the knee. And we're gonna just start here, and we're gonna see how challenging this is. So if you're moving the body all over the place, it's a little too advanced, or you've been doing it a little too long, we wanna make sure the only thing working to keep your balance is this ankle and the leg. So if it's something you can't even hold for, say, 10 seconds, we need to reduce the effort. We need to find a simpler modification. If it's something you can hold for 30 seconds up to a minute, we need to challenge you a little bit more. So a great way to start doing that is to do the same exact thing, but add a little bit of foam to the equation. So the foam has a little bit of give, and it's just gonna make you work that much harder to maintain your balance. So what this is doing, it's really building up those tiny intrinsic muscles of the foot and the ankle that we don't often think about working. And it builds that confidence in the ankle to trust it as you go back to your sports and just activities of daily living. So if the single leg balance exercise is too difficult to perform safely and without pain, we're gonna find a regression and find a modification that you can do to build your way up to that. So what I call it is the kickstand balance. So I'm gonna turn to the side so you can see a little bit better. I'm gonna work on my left leg here. So let's say standing on one leg, I'm not able to do it for a long enough time to actually get a training effect. So a good way to make a regression of that exercise is you're gonna be just up on the toes of the back foot. I call it the kickstand. So it's not really supporting my weight a whole lot. Most of my weight is still in this front leg, but it's giving me just a little bit of confidence and a little extra balance to make sure I'm able to maintain this position for at least 10 seconds to actually have a long enough training effect to, produce some gains from this exercise. So just like the other one, I wanna make sure that ankle, that leg is what I feel working. I'm not moving my body all over the place. Real easy way is just put a little more weight on this back leg and find that balance between difficult but doable. This next exercise is pretty advanced. It's working on the ankle and the Achilles tendon to really take that strength to the next step and make sure that when you return to activity, you don't have a reoccurrence of your injuries or pain. The majority of people don't need to perform this exercise, but it's really great if you're an athlete and you're playing basketball, soccer, you're a long distance runner, something where you're doing a lot of bounding, jumping, sprinting. It's a great way to start training that ankle in a more advanced way. So it's a plyometric exercise, and I'm gonna turn to the side so you can get a good view of it. So I call it ankle hops. So what I'm gonna do here is hop, and I'm gonna use just my ankles to do it. So I'm not gonna be doing a jump where I'm bending the knees, bending the hips. I'm gonna be hopping on just my ankles, where it's just them bending and straightening. And I'm going pretty quickly. I'm not trying to jump a very high height. I'm just trying to get a fast tempo and work on loading that tendon, getting that stretch and that quick explosiveness from that stretch into the jump. So it's something you're gonna do for time. I would start pretty conservative because you haven't done anything like this. You may be a little bit sore. So I would start with just a couple sets of maybe 20 to 30 seconds. And that's all I would do the first day. I wanna see how I would feel the next day, see if I have any soreness, see if any of my pain or stiffness return. But after that, it's something you can incorporate kind of at the start of your workouts or before you do basketball practice or whatever sport you're trying to return to before your runs. Then I might build up to doing this for 30 seconds to a minute, and I would still kind of keep with that every other day. It's not something I would do every day for a long amount of time. I hope you found the video helpful, and thank you for watching.